I'm here with Rafi Spivak, our director of content, who has been learning the recent FDA pre-market guidance in depth, as we all have at Cybellum. And I wanted to ask him a few questions about the new guidelines and what's changed. So, hi, Rafi.
Hey, Shlomi. Yeah, this is a really big one.
Yep, a lot to cover. So we've been hearing for a decade, basically, about these guidelines, and more specifically, what execution will look like. While the overall concepts around cybersecurity for devices remains close to what we've seen in the past, uh, what is the FDA's recommendations for how to actually carry out proper product security activities on medical devices today?
Yeah, we've always had to guess a bit here and there when it comes to the different guidelines, the rubber really meeting the road. What does execution look like? Now, with the latest PMA, they put forward that they want to see a secure product development framework, or SPDF, which the PMA states is a set of processes that help identify and reduce the number of severity of vulnerabilities in products. Now, the idea here is to have a security first mindset. It's been said many times, and it's known that having a device that is completely free of vulnerabilities, at least at this point of the game, with our technology, is just not possible. So, having that security first mindset is really important. And the SPDF and the PMA really lay out exactly what we should have in mind when creating these frameworks and thinking about vulnerabilities. The first is the device's intended use, indications for use, and reasonably foreseeable misuse. That's one requirement. So we have to think of how it's going to be used and what are the common ways that it might be tampered with and the environment it'll be in. The next is the presence and functionality of its electronic data interfaces. It's intended in actual environment of use, like we said. The risks presented by cybersecurity vulnerabilities, the exploitability of vulnerabilities, and the risk of patient harm should a vulnerability be exploited. And so the measures should be upheld from the start and never sway from this security first mindset. And that ensures that the meticulous level of care is given throughout the full product lifecycle.
Right, right. All right. A lot to cover. So, um, it's become a given that no connected product can be 100% secure, right? Leaving much of the ecosystem to simply accept this and allow in vulnerabilities to their devices, which have a varying amount of risk. However, moving away from this acceptance, which we saw as recently as the 2022 updates, the final draft says a device should be designed to eliminate or mitigate known vulnerabilities. For marketed devices, if comprehensive design mitigations are not possible, compensating controls should be considered. So, what does that actually mean for today's manufacturers?
Yeah, the word eliminate is really a big difference there. And simply put, the idea of if it fits, it ships, if I could borrow a line from US Postal Service, no longer is enough. Today, manufacturers are expected to closely consider each software component that's put within their connected devices. And that includes getting documentation from suppliers and vendors of due diligence, of cybersecurity and product security due diligence being conducted on these products. However, if we're speaking about the full ecosystem, including all suppliers, there's going to be adjustment amongst development teams. They'll have to answer for any risk or vulnerability, whether it's open source, in-house, or developed, through some other factor. Let's say custom open source. They're going to have to answer for each vulnerability and explain why they still decide to move forward with a software component, given those vulnerabilities.
Right. So, one of the most anticipated questions for all of us in the industry is what are the key differences between what we saw in the 2022 PMA draft and the final release in 2023? What do you think about that?
Sure. So I've written a few times about this at length. So for this one, I want to keep it concise for all of our viewers. Um, I came across five major changes. The first is, like we said, eliminate, don't mitigate. That approach is really important and should really take priority over everything else. It's really that safety first mindset. The next is interoperability, which is a new section that requires companies to look at periphery communication between new devices and already those in the field, right? We always have trouble integrating either older devices or newer devices, depending on the network we're working with. And so this has to be a consideration from the beginning. Three is that the 2023 guidance allows device manufacturers more flexibility regarding source code access. So this has a few benefits. It adapts real world changes faced by manufacturers who struggle to manage source code. It holds vendors accountable, like we're seeing more and more across government agencies, not just in the FDA. And finally, it allows manufacturers to consider what their source code will look like down the road should a supplier be unable to continue providing service or they go out of business or whatever other reasons there are. The fourth is that CISA's vulnerability database is now a benchmark for medical device vulnerability scans. We've mentioned this a whole bunch, Shlomi, about how different federal agencies are starting to align more and more. And so I really welcome this new specification saying that their vulnerability database from CISA is the baseline. And finally, we have an emphasis and priority put on quality systems. And we've been talking about how quality and security are going hand in hand, product security. So I think the SPDF framework can satisfy this as we discussed, but that is also specifically mentioned, which it wasn't in previous versions.
Got it. So what do S bombs have to do with all of this? Are they still as important as before, or has this version moved away from it?
Yeah, S bombs are still pretty crucial. And as Jessica Wilkinson said recently, a senior cyber policy advisor at the FDA, we're not asking for, and I'm quoting her here, we're not asking for a software bill of material just to ask for it. We're asking for it so we can use it. We do that by cross referencing S bomb information with other known information, such as known vulnerabilities. And if you're going to think about what the S bomb really brings you, it brings you the most basic information in terms of how many components are within, right? So we have atoms, the building blocks of different items or different elements, but within that, there's also further breakdown. So we're stopping here at what is a software component, and from there, we can run scans on it. Because before you can even begin to understand the level of risk a medical device has, you need to know what's inside of it, which again, until recently, was just a really manual task. And sure, even if the original SBOM was developed by the most security minded, greatest people in the world, products go through different development cycles and different life cycles. And throughout, there's updates, there's patches, there's feature additions. Devices go through a lot in the field now. And so, with so many opportunities for people to update an SBOM, there also presents new opportunities for mistakes. And with the mistakes, the introduction of vulnerabilities. So, with the automation of that, which is also required by the PMA, now everyone has a software bill of material for each device. The product security team can begin scanning for vulnerabilities. Process can become standardized, and the ecosystem can really begin having discussions about the software development challenges that they face. So it creates a baseline of documentation that everyone has. They can begin to find patterns within it. From a cyber resilience perspective, SBOMs that are managed and continuously updated with each version or patch make it easier for product security incident response teams, or CERTs, to identify and remediate incidents rapidly because they already know where, if there's a specific component that needs to be addressed, they already can find it within all their devices because their SBOMs have been maintained properly.
Right, right. So to cut to the chase, S bombs are not going
No,
anywhere. Um,
they're here to stay.
so for our last question, yeah. So for our last question, I want to know what hasn't changed. Like what things did the FDA state early on and stuck with ever since?
A lot. In fact, most of it. So they did put a lot of time into getting community feedback, and I think we've seen changes accordingly in the latest PMA. But ultimately, it's clear by reading through this document that the challenges we face are real. Uh, within a few weeks of this draft being posted, the news was filled with stories of healthcare facilities being attacked, medical staff struggling to provide urgent care for patients that were coming in. And we usually think of attacks coming through phishing or someone clicking on a link within an organization that wasn't okay. But let's remember what happened back in 2017 in North America. A casino was hacked through a connected thermometer in a fish tank. So, and we hear a lot of similar stories in the healthcare world, but for various reasons, the stories were not published. They may not be reported. But the risk to medical devices is very real, and that really comes through throughout the PMA. And the obvious difference is that we're not playing Ocean's 11. When it comes to casinos, they're important. They have a lot of information to protect as well. But ultimately, when it comes to those institutions, we're talking financial loss, reputational loss. When it comes to medical devices approved by the FDA, we're often dealing with we're dealing with patients, which we have to worry about life and limb. And more than that, the products themselves are not necessarily being used within healthcare facilities. So we could say within a healthcare facility, as strong as product security is, you also have security over the entire network. But many medical devices now are actually connected to home Wi Fi networks, which may not have sufficient protection, or just operate in different environments that were not previously considered, right? It's important to try to consider them, but you can't think of every scenario. So I think the FDA has really held true to their mission without restricting manufacturers, which is a really, really strong, um, which is a really strong point in that it seemed by reading it that was really a cooperative goal towards better product security and not just the government coming down on manufacturers.
Great, great. So thanks, Rafi. Seems like a lot has changed, but a lot has stayed the same. And thank you for that. And for our viewers, if you'd like to see how we at Cybellum can help you comply with these new guidelines, please reach out to me, to Rafi, or to anyone else at the team. So thanks, Rafi.
Thank you.